Now we'll move on to why we are all here. Dr. Tom Alm's specialties include issues related to chronic illness, end of life, and complicated grief. Dr. Alm has expertise in working with diverse racial, ethnic, sexual orientation, gender, and religious backgrounds, and he has served as a consultant for clinicians learning CBT and as a supervisor for Northwestern University doctoral students in clinical psychology. And with that, Tom, I will pass it off to you. Thanks so much for being here with us today.
Thank you so much for asking me, Cassie. It's wonderful to be with you all today to talk about anxiety. Yes, there are benefits to it. So we're going to get started and talk about benefits and drawbacks to anxiety. And in terms of our outline today, what we're going to be covering, the nature and causes of anxiety, yes, the benefits of it, and then we'll talk about anxiety disorders that appear across the lifespan through childhood, adolescence, adulthood, and older adulthood. And then we'll talk about specific therapeutic approaches. And then since it's holiday time, we want to talk about how we can work with holiday stress. So innate fears have an evolutionary function. You know, our brains were formed and were primed for threat for very good reasons. You know, in prehistoric times, animals, other humans, nature, all provided reasons why we needed to be on alert. And fortunately, our brains evolved forward to include the prefrontal cortex, which is a way for us to inhibit and appraise things that we think are threatening. And we don't have the same kinds of threats that we did in prehistoric times, but our brains are still primed in the same way. But so first and foremost, though, anxiety serves an adaptive function to keep us safe. You know, if we're crossing the street and a truck is bearing down on us, we get out of the way. You know, our body is primed for what you've heard as the fight or flight response. All of the blood goes to the major organs, the heart and the lungs and the large muscle groups in the legs to prepare us to fight or to flee. And so first and foremost, anxiety keeps us safe. Also, anxiety organizes us. You know, if we have a presentation to give, we need to get ready for it. It motivates us. So anxiety gives us information about things that are happening in our life. And so what causes it? There is a genetic component to it. And we know that children of anxious parents are 7 times more likely to develop an anxiety disorder than children of non-anxious parents. But even though there may be a genetic vulnerability, there are other factors that influences whether anxiety becomes problematic or not, such as the way the brain processes information, also experiences that the child has as they grow and mature, and also temperament. And what we mean by temperament are those individual differences that each of us have in terms of reactivity and self-regulation. And we see this very early on with an infant, you know, their level of reactivity and their ability to self-soothe, self-regulate. Okay, and then we need to talk about parental influences. And these are huge in terms of how they affect a child who is growing. And so let's talk about 2 areas here, overprotection and overcontrol. So say 5-year-old Sophie comes home from school crying, and she says, the other kids in my class don't like me, they're mean. Now the overprotective parent will react with something like, you stay away from those kids. So instead of finding out what's really going on and coaching Sophie to find the friends in the crowd, mom is teaching Sophie to withdraw. So the overprotection piece of it. Now, the over-controlling parent might march into the school and demand that Sophie's classroom be changed. And again, Sophie doesn't learn anything about how to turn the situation to her advantage or how to figure out which kids would make good friends. The message she gets is, you can't handle the situation. And this starts very early on. And we always want our children to believe that they can handle any situation. And so then Sophie might switch classes and perhaps another friendship goes sour and then another one. So these are two huge influences in terms of anxiety in parents, overprotection and overcontrol. And I love this slide. Would you let your child climb this tree? You know, we want our children to explore and to take risks. And we want to be alongside them, encouraging and giving support and structure. Parents help worry get stronger by helping kids avoid things that scare them, by keeping them comfortable all the time. You know, often parents will not want a child to suffer in any way. And we learn by suffering. We need problems. We need obstacles. And so, you know, we want kids who can have a problem and decide on a way to solve it. And if the first way they choose doesn't work, then they try something else. And if that doesn't work, then they try something else. That's where a strong sense of self comes from. Often an event triggers the initial anxiety, such as getting called on in class and maybe not knowing the answer or not having maybe the correct answer. And then the child might start to withdraw and not raise their hand. But the more anxiety-provoking situations are avoided, the longer anxiety will persist. It is only by persevering through the challenging situation that the child will have the opportunity to manage that anxious feeling. Martin Seligman at the University of Pennsylvania wrote a wonderful book called The Optimistic Child. And he refers to, you know, there was a period, say in the 70s and 80s, when self-esteem was the rage and everybody gets a trophy, you know, and that's not where a strong sense of self comes from. As I was saying, it comes from having problems to solve and figuring your way through something. Okay, now when does something become problematic? Anxiety disorders are characterized by excessive fears or worries that are recurring or long-lasting. And so we'll start with some things that we find in childhood. Separation anxiety disorder, fear and worry when away from home or separated from parents or caregivers. And these children are tormented by one belief, that something bad will happen to either themselves or to their parent or caregiver, that they themselves will get lost or they'll be kidnapped, or that their parent or caregiver will have an accident, become ill, die. And so you might see in separation anxiety disorder a refusal to leave the home, a refusal to go on sleepovers. You may see physical complaints accompanying that. And then something we call selective mutism, which is consistent failure to speak in specific social situations in which there is an expectation for speaking. You know, we're expected to speak at school. And as you can imagine, there's a huge degree of social anxiety that comes along with this. Then specific phobias, an intense illogical fear of a particular object or situation. Now, there are very normal fears that children have from birth through age 2, fear of you know, separation from their parent or caregiver, a fear of strangers. Between the ages of 3 and 5, it may be a fear of small, dark animals, insects, storms, going in the water, costumed characters such as clowns. And then getting into the school age, fears of natural disasters, shootings. Unfortunately, we have to talk about that now. Medical or dental procedures, having their blood drawn, having injections. And as we get into adolescence, of course, fears of being rejected. That's a huge focus of the teen years. And that leads me into social anxiety disorder, a strong fear of social situations involving being the focus of attention, or being around unfamiliar people, or possibly being scrutinized by others. It might be afraid of talking in class or walking across a crowded cafeteria or being introduced to new peers. And this goes beyond ordinary shyness or self-consciousness. In older children and teens, social phobia can go unrecognized for many years. You know, a parent may be grateful that their child is never in any trouble, or a teacher may say, I don't even know she's in my class. These could all be signals that social anxiety may be a factor. And then panic disorder, which we can start to see in the teen years and go into adulthood. Now, the word panic is thrown around a lot. For an actual panic attack to be diagnosed, a person has to have at least 4 concurrent physiological symptoms. And these could be a feeling of lightheadedness or dizziness, a feeling of choking, difficulty breathing, accelerated heart rate, nausea, numbness and tingling in the extremities, sweating, derealization, in other words, feeling like things aren't real, or depersonalization, where someone has a sense that they're not in themselves, that they're not in their body. And so that's what classifies as a panic attack. And a panic attack reaches its peak within several minutes. So these are pretty quick acting phenomena. And so panic disorder is diagnosed when there are recurrent, unexpected panic attacks, and at least one of the attacks has been followed by 1 month or more of one or both of persistent concern or worry about additional panic attacks or their consequences. And some of the consequences that are feared include, I'm having a heart attack. You know, often people will go to the emergency room. It feels so awful. And they'll be given a clean bill of health. And, if after this happens a couple of times, the astute emergency room practitioner will say, we think that it would be a good idea to see a mental health practitioner. Another consequence is like a fear of going crazy. And then there could be a significant maladaptive change in behavior, such as, say, panic symptoms were felt on a train, and so the person stops going on trains, or they stop doing certain things because of the fear of panic symptoms. And then when panic symptoms, when there's a fear of panic symptoms beginning and the escape might be difficult from a situation, we call that agoraphobia. So sometimes panic disorder with agoraphobia is diagnosed. Say, sitting in the middle of a row in a movie theater, or being in enclosed spaces like elevators, or open spaces such as bridges. And so we call that agoraphobia. And then generalized anxiety disorder, which is excessive anxiety and worry, what we would call apprehensive expectation, occurring more days than not for at least 6 months about a number of events or activities, such as work or school performance. And another key part of this is that the individual finds it difficult to control the worry. And then some additional symptoms, sleep is affected. It could be difficulty falling asleep or sleep that is not restful. It could be feeling restless or keyed up or on edge. Muscle tension can be present. There can be a feeling of difficulty concentrating or your mind going blank. And generalized anxiety disorder leads to more primary care visits than any other anxiety disorder. And in children, this can show itself as worry about being competent or the quality of their performance in school or in sports. And I want to just briefly talk about 2 other disorders that were previously classified as anxiety disorders but are no longer, with our new DSM, Diagnostic and Statistical Manual, which is a way for mental health practitioners to communicate as well as communicate with insurance companies. There were 2 areas, obsessive compulsive disorder. An obsession is a recurring thought or image that provokes anxiety, and a compulsion is a behavior that's an attempt to relieve the anxiety. And the person spends a lot of time engaged in these obsessions and compulsions. Now that's in a separate category called obsessive compulsive and related disorders. And then one other disorder that used to be classified under anxiety is post-traumatic stress disorder. And now that is classified under trauma and other related disorders. Okay, so there's a summary of anxiety disorders across the lifespan, and we want to talk about therapeutic approaches and intervention strategies. All right, cognitive behavioral therapy, or CBT, has been shown to be both efficacious and effective for anxiety disorders. And when I say efficacious, I mean that it has undergone rigorous research trials. We call them randomized controlled trials with manualized treatments. All therapists giving this in these research studies have been trained in the same way, use the same identical manual, and people are randomized to either the therapy that we're testing or to treatment as usual, which could be supportive therapy. And so CBT has efficacy, and it's efficacious if it works in ideal situations. It's effective if it works in the real world, and CBT has been shown to have both. And so what are the components of CBT? Well, first of all, there's education, much like what we've talked about today, what anxiety is, where it comes from, why it's necessary, and what keeps it going. And we know, based on what we've talked about today, right, that avoidance of anxiety-provoking situations keeps it going. Body awareness and management. And this will include diaphragmatic breathing that we're going to talk about in a minute, as well as progressive muscle relaxation. Working with thoughts. You know, our thoughts are so powerful, they can hijack us. And we're going to talk more about that. And then exposure. You know, this is the foundation of treatment for anxiety, is approaching what you're anxious about. And exposure is about approaching things, you know, in a graded fashion. You don't want to go to the thing you fear most right off the bat. You know, we want to take something that provokes some anxiety, but it's not too overwhelming. And we do what we call behavioral experiments to go into that situation and know that you can tolerate the anxiety. And here's really a representation of the cognitive model, that what you think influences how you feel, which in turn influences what you do, your behaviors. So say, for example, the situation is I get invited to a party and my automatic thought is, I'm not good at talking to people. Now, some possible feelings that might come with that could be anxiety, maybe some sadness. And then what will I do in that situation? Maybe I won't even go to the party. And then that sends me in a spiral. Wow, I can't even go to a party. What kind of a person am I? Or if I do go to the party, I might stand off by myself and not say very much. And so the importance of the interrelationships between thoughts, feelings, and behaviors. So it's important that we work with these thoughts. And Aaron Beck, the founder of cognitive behavioral therapy, refers to these as automatic thoughts. He was trained as a psychiatrist and a psychoanalyst, and he found that he got much more information when he noticed a change in affect or a change in the presentation of someone's face. And he would ask the question, what just went through your mind right then? And he saw the relationship between a thought and a feeling. And so in CBT, we pinpoint the negative anxiety-provoking thoughts, images, and ideas that fuel anxiety and reframe those thoughts using coping-focused thinking. And oftentimes, especially when we're under stress, our thinking can be distorted. And there are some very common distortions, one of which is all or nothing thinking. For example, it's all my fault. Things will never get better. If I'm not perfect, I'm a failure. Sorry, I went one too far. Mind reading. Thinking that we know what someone else is thinking about us. For example, he must think I'm an idiot. Or fortune telling, fortune as in going into the future. I know that I won't have fun at the party. And then catastrophizing, which is a very common one in anxiety disorders. Since she turned me down, I'll never have a girlfriend. Or I'll feel awful if it doesn't go the way I want it to. And so working with those thoughts, what's the evidence that the automatic thought is true? What's the evidence that it's not true? What's the worst thing that could happen? What's the best thing that could happen? And importantly, what's the most realistic thing that will happen? Even if considering the worst possible outcome, could I live through it? Thinking about what's the effect of my believing the automatic thought? What could be the effect of changing my thinking? And another question we ask is, if another person was in this situation, if a friend was in this situation, how would you talk to them about this automatic thought? We're taught to be very supportive of other people, but we're often not taught that ourselves. We're into the realm of self-compassion here. And there's a huge body of research coming out of the University of Texas at Austin around self-compassion. Kristen Neff, NEFF, is a main researcher in the field of self-compassion. So those are some of the questions that we would ask around some of these automatic thoughts. So looking at thoughts and then exposure techniques, gradually facing anxiety-provoking situations. Okay, so let's all practice diaphragmatic breathing. If you could all sit with your feet on the floor and your hand on your abdomen. And if you take a nice full breath in, you should feel your hand moving out. If you're breathing with your diaphragm, the diaphragm is the muscle that separates the thoracic cavity from the abdominal cavity, and it lowers to allow the rib cage to expand when we inhale. And so let's try that again, taking a nice full breath in and letting it out. Okay, and often what happens when we're anxious is that we're over breathing. And in the context of panic, we're taking in too much oxygen, and oxygen binds with hemoglobin on red blood cells. And taking in all this oxygen, all of the hemoglobin gets saturated and it gets sticky, and it's not able to be delivered into the tissues adequately. And that's what's responsible for all of the physiological symptoms in the context of panic. Now, another area that's so important is mindfulness. And John Kabat-Zinn, he was trained as a biochemist at MIT, but later I think he was probably the person most responsible for combining Eastern philosophy with Western psychology. And he started working with patients with chronic pain to help them come to have a different kind of relationship to their pain. And he would define mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. This kind of attention nurtures greater awareness, clarity, and acceptance of present moment reality. And he wrote a wonderful book, Wherever You Go, There You Are, as well as Full Catastrophe Living. So much of the time, our minds and our bodies are in two different places. I'm sure we've all had the experience of intending to pick something up on our way home, and we get home and we don't have it. We're on autopilot. We're not really present. And so mindfulness is a way for us to align the mind and the body so that they're more aligned more often. Mindfulness is curiosity about our own experience. It's being kind and compassionate with ourselves and with others. It's about awareness, noticing where our mind takes us, and then coming back to the present gently and firmly. And so different ways of practicing this. One is awareness of the breath. So as we did a little bit earlier, having your hand on your abdomen and closing your eyes if that's comfortable for you, and bringing your attention to settle on the breath. Just this breath coming in, just this breath going out. And if you notice your mind being pulled to thoughts, just acknowledging that, and without clinging to the content of the thought, gently and firmly bringing your awareness back to the breath. So that's an example of slowing down the way we take in the world, right? And we can notice how active our minds are. And we need to practice coming back to what's happening right now. We're missing out on right now. And so other ways of practicing being mindful include noticing external events, focusing on things in your environment, specific objects in the room that you're in right now, or closing your eyes and focusing on sounds that you hear, not trying to label them or think about them. This is just a practice of noticing. And then we can practice noticing external events, and we can practice noticing internal events, thoughts, feelings, and sensations. So we can notice, and you can just say to yourself, thinking, or be more specific, like judging, worrying, analyzing, or noticing a feeling. And you can silently say the word feelings in your mind. or be more specific, like anger, frustration, whatever it is, or noticing bodily sensations. And then practicing noticing when your attention wanders. Practicing patience with the present moment, staying in this moment and noticing the urge to rush ahead to the next thing. That's just so common for all of us. You know, we're on to the next thing, but the problem is we're not giving our full attention to the here and now. So other ways to practice mindfulness in daily activities. Focusing awareness on the breath when a specific environmental cue occurs, like you've just dialed someone's number and you're waiting, or you're waiting at a red light, walking, listening to music, getting dressed, picking something in your morning routine. You know, the shower is a famous time for us being all up in our heads about planning the day, you know, and why did she say that? Or why didn't he do that? Instead, what does the water feel like coming down on your back? What does the shampoo smell like? Mindfulness of domestic chores, you know, thinking about, you know, when you're washing the dishes, wash the dishes. What does the temperature of the water feel like? What do the suds feel like? Thich Nhat Hanh, the Vietnamese monk, used to talk about when he was little, and he would sit on his front stoop and in his bare feet and feel the cat underneath his feet. And his mother would give him a cookie, and he just savored that cookie. And so he's famous for saying, when you're eating a cookie, eat a cookie. You know, we're in such a hurry to move on. So speaking of cookies, eating, you know, so much of the time we're in a hurry and we need to rush through things and we swallow things whole and we have no idea what just happened. Instead, can you notice the smell of the food, the texture of the food, the flavors? Mindfulness of breathing, of sitting, talking on the phone, driving. You know, what does the steering wheel feel like? Cooking is a wonderful way to practice mindfulness. You know, what does the knife feel like as it goes through the lemon? You know, the sounds of something sautéing, the smells. Other things to notice: examining an object, hugging someone, listening to a friend. Okay, and mindfulness serves as the basis of a subset of CBT called acceptance and commitment therapy, or ACT. And sometimes people cringe when I use the word acceptance, but acceptance does not mean resignation. Acceptance doesn't mean that you like it, or that you think it's right, or that you think it's fair. It's just accepting what is, accepting reality, and then taking committed action toward what's important to you. And so the three central tenets of this that really sum it up is be present. In other words, that's the mindfulness skill, and taking an observer stance on things. You know, we observe our thoughts, we observe our feelings rather than acting from within them, acting within the anger we're feeling. You know, that observer stance allows us to get some distance from a thought or a feeling. And then opening up, diffusing from unhelpful thoughts or beliefs. You know, possibly asking the question, how is this thought helping me? How is this thought helping me be the person I want to be? How is this thought helping me be the partner I want to be? And then opening to all emotion. Oftentimes there are certain emotions we don't want to have, but as human beings, we're going to have them all. So thinking about ourselves as containers that can tolerate all different kinds of emotions, some just very, very uncomfortable, but we can learn to be with them and tolerate them. We're having them for a reason. And then finally, do what matters. Live according to your values. So I love those 3 summary statements: be present, open up, and do what matters. Okay, now holiday time, we need to talk about how to manage stress around this time. And I want to build off of, there was an article in last winter's Northwestern Alumni Magazine by Judith Moskowitz from the Osher Center for Integrative Medicine at Northwestern. And her research demonstrates 8 positive emotion skills that help us. And we've talked about some of these. Noticing positive events. So often we blow right past positive things. We're on to the next thing, or we're on to the thing that could potentially be threatening to us. Savor positive events. We don't savor things enough. We don't savor these wonderful things like a shave or a foot bath or whatever it is that brings you joy or comfort. Gratitude. The research is continuing to tell us about the importance of practicing gratitude. We've talked about mindfulness. Realistic reappraisal or reframing. And this is the working with thoughts that I was talking about. We need to be realistic in our appraisal of situations. Noting personal strengths. Oftentimes we let those go. Setting and working toward attainable goals. And then acts of kindness. Getting outside of ourselves always puts us in a better place. And some things that I would add, allowing room for all emotions at holiday time. There's so much expectation about this time of year that we're supposed to be happy. And I think humans think they should be happy most of the time. It's a myth. Russ Harris, an Australian psychiatrist, wrote a wonderful book called The Happiness Trap. We're going to experience all kinds of emotions. And yes, we may experience some contentment, maybe joy at points, at different things, maybe at watching a child open a gift or listening to a musical performance. But holidays can also be associated with difficult emotions. It may be the first holiday where a family member who has died is no longer with us, or we're missing family members because of distance, or all different kinds of situations. And allow room for all of that. I think sometimes people feel like if they are sad, that they're going to circle the drain and they're going to go to this awful place. Emotions ebb and flow. It's not going to hang around forever. We need to allow ourselves to experience the hard emotions as well. And I think in our world that, sadness is very normal. And I think it goes much too quickly to being called depression or feeling depressed. I want to emphasize that sadness is a very normal emotion. And then being realistic about how much you can take on. Don't overload yourselves so that you're feeling overwhelmed and you just don't know how you're going to get everything done. Lists are important for some people, and having one list, right? Think ahead about, sometimes there's this idea that, oh, mom can do it all, or grandma can do it all, and being able to set limits. I don't think I can tackle that this year. and noticing the pressure to follow traditions. This comes up in, some of very elaborate food preparations for different traditions. And, you might not have time to do that this year for whatever combination of reasons. And so, maybe thinking about new traditions, and thinking about, what's important to you about the holidays, that it's not wrapped up in doing things or doing events, or, maybe some of it might be, but thinking about, what really brings you comfort and joy at this time of year. And then finally, some important self-care, definitely exercise. The research continues to tell us about the long-term benefits of exercise, watching food and alcohol consumption, and getting good sleep. And then some resources that I just want to point out. Anne-Marie Albano wrote a wonderful book, You and Your Anxious Child. She's at the Columbia University Center for Anxiety Disorders. Frank Bruni wrote a wonderful book, Where You Go Is Not Who You'll Be, an antidote to the college admissions mania. And then Wendy Mogul, The Blessing of a Skinned Knee. And I was referring to this earlier, the importance of our children, that they have problems to solve. And then Reed Wilson, Playing with Anxiety, a guide for teens. And then just two areas that have wonderful public information, the Anxiety and Depression Association of America and the Association for Behavioral and Cognitive Therapies. So good. So I'd love to hear any questions that you have. Cassie, can we go to questions?
Yes, definitely. Thank you so much, Tom, for all of that really great information and sharing all of that. To kick us off with questions, I'd like to start with, I think the 8 positive emotion skills that you mentioned were awesome. How do you recommend folks on the call today to remember to come back to those when they're struggling potentially?
Yeah. So the first thing is developing awareness, right? We can't work with something we're not aware of. So that might be, say you're in your car and you're feeling really upset, maybe taking a breath, grounding yourself, what does the steering wheel feel like? And so awareness is the key, and then looking at what possibly could be going on and identifying it. Identifying an emotion is the first step in being able to regulate it. So we have to say, I'm angry, I'm frustrated, I'm whatever, and so when we can say that, and then maybe writing about it, I feel disrespected when, or I'm feeling angry when, that helps us be very specific about our emotional experience. And so working with the awareness, and then I think it's a matter of noticing positive events. I think, I think when the more awareness is increased, the more you're going to be aware of the things happening around you, or the wonderful conversation you just had with someone, or someone's care for you in something that they said or did. So I think the key is developing the awareness, and that really speaks to the mindfulness skills.
Yeah, definitely. No, that's really helpful, Tom. And coming back to the panic attacks and the panic disorder that you had mentioned, I'd love to hear more from you on the difference between the two. And then also, when do people typically have their first panic attack? Because I've heard of people who, will have a first panic attack and have no clue, like you mentioned, that that's what is going on. can you give us an idea of some of the other symptoms people may experience?
Sure. So panic can, start, from the age of, say, 9, 10, 11, 12, throughout adulthood, into older adulthood. And it's a sudden rush of anxiety. And then you start to notice these possible physical symptoms like feeling lightheaded or dizzy, sensations of choking or difficulty breathing, accelerated heart rate, nausea, numbness and tingling in the extremities, sweating, feelings of not being in your body, or feelings like things aren't real. And like I said, we need to have at least 4 of those for something to be classified as a panic attack. Mm-hmm. And the anxiety rushes and it reaches its peak within a few minutes, but it's terrifying. And, if you have less than 4 symptoms, the DSM specifies 4 based on research. But if you have less than 4, we would just say that there are symptoms of anxiety happening, and, I'm working with a student right now who told me about a panic attack that she had in a stadium. She was in the middle of a row, and she's, being in the mental health field, she knew what was happening. And she just said to herself, it's a panic attack. She put her head between her legs. She was breathing, and she didn't have to leave the situation. And so, but they can be terrifying. But the most important things about panic are the symptoms are not dangerous. It feels awful, but like I said, there's a reason why all those symptoms happen. We're taking in too much oxygen, and then the oxygen carbon dioxide balance gets off, and then the acid base balance in the blood gets off. And so in order to get that back in balance, we need to do what we call breathing retraining. So counting 1, inhale, and then before you exhale, you say the word relax to yourself. So 1, inhale, relax, exhale. And then you would count 1 all the way up to, say, 10, and back to 1, or 1 up to 20, and back to 1, depending on how you're feeling. So breathing retraining is an important thing, as well as jumping to conclusions that the physical symptoms are dangerous, which they are not. And then catastrophizing that I won't be able to cope with it. I knew that my last panic client, I knew he was okay when he said he was having a panic attack at a wedding, and he said, oh, it's just a panic attack and I can handle it. So I knew he was okay.
Oh, wow. Yeah, that's so interesting that you can have these physical symptoms but it's going to be okay in just a short amount of time.
Yes. And the idea is to start the breathing as soon as you notice any physical symptoms.
Mm-hmm. Mm-hmm. Yeah, no, that's really helpful for folks who may be experiencing that, or in the future may have an onset of panic attacks. Mm-hmm. Tom, we have a few questions coming in about CBT.
Excellent.
Awesome. So one person writing in is saying CBT is often used and well proven for many people, but she's heard, however, that it's best for anxiety that is somewhat focused in nature or single symptom, quote unquote. Do you agree with that? When do you think CBT is great, and when is it not so great?
Well, I think that all anxiety is rooted in nature to some extent. There's not a gene for, say, social anxiety or for generalized anxiety, but we know that anxiety is heritable. And so in my first session with a client, I'll always ask about family history. So, CBT is absolutely appropriate for nature. And CBT is appropriate for, I think everyone can benefit from CBT, because we all think, and our thoughts can become problematic. So I think anyone who doesn't suffer from anxiety can benefit from CBT. But she's absolutely right around that CBT has been proven effective for very specific anxiety disorders, such as social anxiety disorder, phobias for panic disorder. Now, I like to expand on it. I want to give someone as many tools as possible. And so that's why I love this third wave of CBT. The first wave was behaviorism. The second wave was classic CBT, working with thoughts and beliefs. And the third wave is the mindfulness and acceptance-based part of CBT. So I always include mindfulness and an acceptance perspective and a self-compassion perspective with all my clients.
Mm-hmm.
I
Yeah,
hope that's
no, that's great.
Mhm.
Yeah, definitely. And if people have clarifying questions, please feel free to send those in too as we continue to take questions. Another one, Tom, is that are there any recommended resources for finding a counselor or other professional that specializes in CBT?
Yes, great question. And so if you go on that, the Association for Behavioral and Cognitive Therapy's website that I have on the resource page, abct.org, and there's a Find a Therapist feature on there. And then you put in your zip code and how far you're willing to travel mile-wise, and they will come up with the CBT practitioners in your area. So that's a really effective way of doing it.
Yeah, that's great. And outside of CBT, in terms of recommendations for folks who are looking for help, where do you recommend them going for general resources? What about medications? What's your take on medications for anxiety?
Yeah, well, I'm so glad that I went to a doctoral program that was focused on treatments that are based in research. That's what I really encourage everyone. And CBT is based in research. ACT, acceptance and commitment therapy, and mindfulness are based in research. So I encourage people in searching, when they search for a therapist, to find someone who practices within that realm of that their practice is based on research-based treatments. And I always like to start with therapy. If someone is profoundly depressed, and it's been going on for, several weeks, and they're really finding it hard to manage their life, I will definitely recommend a psychiatrist to prescribe medication concurrently with the therapy. I think, after a trial of therapy, maybe I decide, I think it's important to augment the therapy with medication. And then I'll refer at that point. But I always think, I think sometimes people will end up attributing getting better to medication when I want someone to get better with themselves and knowing that they have skills that they can use. And that research has shown lasts longer when you teach someone skills to use in different situations. So I'm all about therapy.
I love it. No, that's great. And I appreciate your take on it, Tom. And Michelle was writing in again, asking about supplements. Is there what's your take on supplements outside of medications, potentially vitamins? And
Yeah, that's a great question. I would, and I don't have expertise in that area. I would consult with your primary care doctor, or a psychiatrist. It's important to understand any possible interactions of supplements with medications that you're taking for whatever, so that would be important to talk with a prescriber about.
Mm-hmm. Yeah, definitely. This is great, Tom. I really appreciate you answering all of our audience questions and for sharing all of these really great resources and tips and techniques and skills. And I'd love to give you a minute or two, as we get close to closing out the webinar, if you have anything else that you'd like to share before we end for the day.
Yeah, thank you so much for inviting me, Cassie, and it's been a pleasure to meet with you all today. And I think that it's possible to be in our lives and to increase our awareness of things, and that we can manage anything. That is such a powerful idea, that we want to encourage our children from an early age to get that idea of confidence that I can manage anything that happens. That's a very powerful idea to have. And so, I don't think there necessarily needs to be a problem for you to go see a mental health practitioner. It's about being well. And so I would encourage, if you want to learn skills, contact a CBT person to learn ways of working with troublesome thoughts, ways of deepening your sense of awareness and your sense of self-compassion, so that you can live in the best way possible. Mm-hmm. Thank you.
Yeah, thanks, Tom. Thanks for those closing notes and for spending this last hour with us. We really appreciate it. And of course, thanks to everybody for tuning in to today's presentation. We really appreciate you joining us. You can find all of our archived and upcoming presentations on our website at alumni.northwestern.edu/career webinars. And we hope you all have a great rest of your day. Go Cats!